afternoon, everyone. Although we are having this seminar in a web format, I would like to acknowledge that this event is being held on the traditional lands and pay my respect to elders both past, present, and future. Welcome to a new edition of Polaron Connect webinar series. Today, we will talk about how to make your website work for diverse audiences. Please feel free to send us your questions using the chat box on the right-hand side. Our panelists will be answering your inquiries at the end of the session. I will now hand it over to Eva Hussein, our facilitator for today's webinar. Thank you.
Wonderful. Thank you so much, Andrea, for that introduction and for the warm welcome to country. I wanted to extend my warm welcome to everybody that's attended. We've got, I think, over 50 people, so that's really great that there are so many people interested in this topic. And I wanted to introduce myself briefly, but I think many of you might possibly know me, so it does feel like I'm a celebrity, but I'm not really. But I am the founder and director at Polaron. I also practice still until today as a translator and interpreter, so you know, a lot of my views are based from the ground up, I guess. We also have Nicholas, who's our client relationships manager at Polaron. Hello, Nicholas. And we are very, very privileged and very happy to have Christy from Diabetes Victoria on board. I've known Christy for probably about 6 or 7 years, and she does really, truly amazing work out there with diverse community, but she also holds the portfolio of Aboriginal portfolio, I guess, at Diabetes Victoria, and also the cultural diversity program. So she will be able to tell you about her own experience with working within that portfolio and a website which she was instrumental in putting together for Diabetes Victoria. We've been around for 20 years, and we do all kinds of things to do with language, interpreting, translating. We've got about 1,500 different interpreters and translators working for us in about 170 languages, I think. So this is our 20th year. There's just a picture there on your screen of one of the events we run every year, which is a diversity forum. We've had to cancel it in March of this year, but we're hoping to run it later in the year. So just moving on from that. Today we're talking about web accessibility, and let me tell you that when we picked this topic and when we started researching for it, I was really disappointed to see some of the practices out there. So today we're going to be talking about good practice, but also show you a few examples without naming and shaming of what not to do. Because I think, you know, the way we communicate has changed a lot in the last few years, and that goes across the board for everybody, whether you speak English well or don't speak English well, or you know, it doesn't matter who you are. But the main focus of many organizations, and that includes government agencies, is to go digital. And that is, Andrew, if I can take us back to the slide before, that's an issue, because we are leaving people behind. Many people are left behind, and that includes myself. You know, I do, you know, I'm educated, I'm knowledgeable in many things, I speak English, but I still feel left behind in many ways and frustrated. And I think what that research showed me personally is that there are many school of thoughts and a lot of confusion out there. So what we've put there on that slide is what is web accessibility, and essentially it's a way for organizations to make the information available in a way that people can see, understand, navigate, and interact with. So it's pretty simple. But it's very difficult to do, is what I'm trying to say, based on what I'm seeing out there. So next slide, Andrea, please. And when we talk about diverse audiences, sometimes people think that they have to do things differently. And the truth is that they don't. There's just a couple of considerations, such as languages, that we need to look at. But the basic premise of making information that you want to make available to people accessible is the same regardless. So yes, you do need to perhaps look at languages that you communicate information in, you know, how you're going to name information that's on your website, because I don't know about you, but if I am looking for information in Polish, I'm not going to type into the search engine resources, multilingual resources about cancer. You know, what I'm going to type in Polish is information about cancer. So these are some of the things that we will be covering today. And also the navigation needs to be a lot clearer, and where your multilingual resources are put on your website. Because what I found through my you know, research, or looking through you know, probably hundreds of websites, is that translated resources, information in other languages, is deeply buried into people's websites. And people, to be honest, have no hope of finding it. You know, when we talk about producing information for diverse audiences, it is not about ticking boxes. It's about firstly translating it or making it available in a way that people understand, but also placing it on your website in a way that people can find. And that's really quite important. So we say here, it shouldn't be that hard, right? It's you know, basic principles, things that are logically sound, and but apparently it is. So we've put some examples there for you to show you what can happen if, for example, you use automated translation tools. So this particular website is a government website, and it deals with public emergencies. You can see on the screen that that's what it talks about, and it's you know, one of our states in Australia that's a governmental website, and we've looked at how things were translated through Google Translate. So you can see in that red circle that it's enabled, and I've looked at my language, which is Polish, and I'll show you what happened there once we get to that slide. So one of the information that this particular website talks about is 000 emergency. So, you know, key fundamental service that there shouldn't be any confusion about using it. But into Polish, through the automated translation tool, where it says, please dial 000 if it's an emergency, into Polish, and I translated it back into English for you, it says, in a life-threatening alarm, shield 000 in brackets. I don't understand what that means. And honestly, that kind of message, if I was to go to this website, didn't speak a word of English, translated it automatically into Polish, I wouldn't know that that's the number I need to ring if I'm in trouble, if I'm in emergency. You know, everything else on this website could be absolutely perfectly linguistically correct, beautiful Polish. That one bit makes it useless, and it makes me very angry, as you can tell, because there are people that are probably you know, getting the wrong information, or we're putting them at risk by enabling these kinds of tools on our websites. And we move on from here to show you another example of, and Christy will talk about 3 clicks principle in a moment. I think when we briefed, it was something that's quite eye-opening. But these are mental health resources. So first of all, everything around that is in English. So when I go to this website, I cannot see that it doesn't include me if I speak a language other than English and I'm after information on mental health. So it's deeply buried in the website, and it also says, interestingly, please be aware that where resources have been developed by organizations other than us, we are not responsible for the advice or information provided. So my question to this particular service provider is, why put it there? What purpose does that serve if we are putting information out there that we cannot rely on? So for me, it's a very basic question that service providers should be asking themselves, because if you're doing this just to tick off boxes, don't do it, because this is, you know, for me, it is you know, disrespectful or really exclusive. We're creating another layer of isolation for people. Andrea, if we could move on, where you know, I cannot find this information if I have a mental health issue. So that's the 3 clicks principle. This is about 5th click. So you can see on that screen there right in front of you that everything's in English. None of the languages are clickable there. So if I speak Turkish or Swahili, I cannot click on that. It just gives me a list of languages that's available, and then I have to visit another website outside of this website. So, you know, it really isn't very user-friendly. This is another example that at the very bottom you'll see it has Google Translate everything again, and it says, and this is a governmental website, by the way, our website uses a free tool to translate into other languages. This tool is a guide and may not be accurate. Why have it, is my question. You know, and I'm very passionate about this because it's not, it really isn't helpful. So what we thought we'll do is we'll show you what it's like for a non-English speaker to get this automated tool enabled on your website. And I just found a Polish website that talks about mental health. In the red circle there, you'll see that it's an automated tool, and we move on to the next one. And now I wanted to show you what happens when you translate without input from humans. So the first thing you see under the word suicide is suffer from depression. It is not a language we would ever use nowadays in Australia. We don't suffer from diseases. We have or we live with diseases. You know, we've done so much work around that language being inclusive. But if you just use your automated translation tools on your website, that's what might happen. So sorry. Andrea. So what I'm trying to explain to you here is to put in the shoes of someone that might be reading it. And again, you know, you might get the gist of what they're trying to say, but then he talks about self-assembly, whatever that means, okay? Do you suspect depression at home? I don't really know what that means, but it talks about suffering and sufferers. And next slide, Andrea. So, you know, but by providing information that is somewhat correct, we could actually be doing quite a bit of damage. I'm hoping that people can see that. And this is next slide where it talks about motor excitement. I don't know, maybe that's like riding your bike around the block on your bike. I don't know what that is. And then serious sins and crimes and dysphoric mood, and, you know, certainly not a language that we would ever use. This is just a way of you to see what might happen. Next slide, Andrea, there, thank you. All of this I wanted to put in the context of policies, because governments that give us money, you know, taxpayers' money to translate things, expect us to follow the guidelines. This is a guideline of the Australian government to do with automated translation. So the first thing it says there, underlined in blue, is that translation of government documents should be performed by NAATI credentialed translator wherever possible. Then it says non-accredited but bilingual staff or automated translation should not be used as a substitute, and especially if those documents could have significant legal consequences for the agency. And then below, the use of online automated translation tools should not be used for the translation of government publications or information. This cannot be clearer, any clearer than that. Next slide, thank you. So we've also given you Victorian's government's policies, and that says that Victorian government currently advises against the use of automated interpreting and translating tools, which cannot at present be guaranteed to be accurate. While some machine tools are improving, they still have a reasonably high chance of incorrectly translating information. And I think with my Polish website, I kind of show that. You know, the other at the bottom, the other very important statement is that interpreters and translators should be NAATI credentialed. And NAATI has gone recently through a change. It's now called certified, not accredited. Nevertheless, according to the policy, you know, NAATI translators are the people that we should be working with. I will now hand over to Nicholas, who will tell you about how we try and support organizations we work with in terms of accessibility for diverse communities and websites.
Thanks, Eva. Yes, look, you've touched on some really, really great points and shown some terrific examples of what not to do and you know, what the worst practices can be when it comes to web accessibility. So now I'm just going to touch briefly on 10 quick tips, 10 easy tactics, how to overcome those barriers and how to increase your web accessibility for cold audiences. Now, in the interest of time, I am going to whip through these quite quickly. So if anyone does have any questions, please feel free to pop them in the Q&A section of the webinar. The first tip here is to remember that everyone struggles with digital. Now, I don't know how many of you have either, you know, tried to access a webinar or even tried to host one, but for me, it was so difficult. And even just setting up the microphones and the audio and the webcam, it's a headache. So imagine how difficult it is for a cold member of our cold community to access something, you know, in a digital format. It can be 10 times as hard, especially if it's in English. Hence, the next following tips are so important to improving their time with digital communications and their experience with digital communications. You need to adopt an inclusive mindset and a creative and create awareness. What that basically means is we need to be inclusive in how we're publishing our resources or how we're disseminating our information. A lot of, you know, companies out there, and I've jumped along a lot of websites in my time as a manager here at Polaron, and I see this same old format, which is about us, what we do, information and resources, contact us, and it's all in English. Now that's nor inclusive, nor is it creating any kind of awareness. It's almost like you've got a blank book cover for your organization. You need to improvise and develop a much more unique website that's a lot more inclusive with translations or in-language resources, even plain English sometimes, and that's going to be the third point here. Looking for ways to make it easier. Now, we're not hammering down your throat that you need to come through Polaron or any kind of LSP and translate your resources. Sure, that's going to help cold audiences, but even just writing in plain English, which is, you know, a level of accessibility that we're providing to cold audiences, is a huge, huge help. If you're able to find someone who's got some sort of background in, you know, those literary skills, you might be able to just simply transfer your website into plain English or parts of your website into plain English. And that's going to help a lot in terms of reaching those cold communities out there that have got low literacy levels. You need to learn about your audience as well. And that's point 4 here. Now, this is key because if we're diving into the deep end and developing translations for communities that may, for example, have no you know, presence here in Australia. I was just speaking with Eva and a client the other day as to a website that had 40 Google Translate options. And there they had, you know, some obscure languages that there's probably 1 or 2 people here in the community. It's important to learn about your audience, reach out to the community, speak to providers that have got the knowledge and learn what communities you need to be targeting. If translations are so expensive, then the more you learn about your audience, the more you're able to prioritize the ones that matter the most. The 5th point here is to consider literacy, visual, hearing, motor, and cognitive abilities of your audience. That's imperative, and this kind of goes along with point 3 that I've said. Not everyone's literacy levels are the same, and definitely amongst cold audiences, some struggle to even read resources. So even translating your website might not be enough. It's important to diversify and look at different ways of disseminating that information, whether it be via audio, subtitling, a video, doing a lot of things with images. Plain English, once again, is a really great tool. These factors will all really help in terms of getting to those different areas of the cold community. 6th point here is to translate content when appropriate and serve it in a variety of formats. And there's a dash there, chunk it. The reason I say this is because, yes, you need to translate your content. It's so important because there is a vast majority of you know, Australian citizens and people here that reside here that don't speak English. And for your information, it's 25% of Australia. That's 1 whole quarter of Australia that speaks a language other than English at home. So when you're translating your website, not only are you doing the socially responsible thing, but you're going to be doing really good from a business sense as well. And I had this conversation with a client the other day. I hope she doesn't mind me using that example. But if you're not going to do it for the social reasons, do it for the business sense at least. And chunk it. Make sure it's chunked, because there's no point taking a slab of information on your website and just putting it through the translations process. It's important to do it a bit at a time, and pick specific resources that you know are important and are more urgent for the community. Moving on to the next point here, display your content in an easy to find way. I'm going to touch on that a little bit more in the next few slides, but basically that talks about what Eva touched on, navigation of your website. The three-click principle that Christy might touch on. Everything needs to be easy to find, and having slabs and tabs on your website with heaps and heaps of information is doing you no favors. Ask for feedback. Asking for feedback from the community, that's a huge one. The amount of people I know that come to us and other providers out there, get some things translated for their cold audiences, and then just run away and say, thank you very much for doing that. Publish it to their website, and guess what? They've published Dinka instead of Dari or something obscure like that. It's so important to just get it quickly pilot checked by the community or by the provider that gave it to you. It's not difficult. It's not cost intensive. You just need to reach out and ask for that process to happen. The last 2 points here kind of go hand in hand, but don't just talk about it, do it. I hear a lot of people talking about, this is so expensive, or this, we don't have the budget for it. We don't have the, the campaign's not ready yet. You can just do parts at a time. Chunk it, as I've said before. Start with something small. Even a small message on your website that welcomes cold audiences in is more than enough, and it's not super expensive. The 10th point here, once again, if you think it's too expensive, think how much it costs not to do it. Now, I'm just going to touch on that example that Eva brought up before with the mental health page in Polish. You saw the kinds of things that Google Translating or not going through the effort of translating things properly does to your website and thus to your audiences. How much more devastating will that be if one of your cold audiences reviews that information, sees that it's misinformative, it's unclear, and not just that, but it's crude. That could end in terrible results in the community, and God forbid, but death in some stances where we're talking about depression and suicide. So I just want to jump onto the next example here really quickly, because in the interest of time, we don't have too much longer. Thank you so much to Breast Screen Victoria for allowing us to use their website as an example. And this is, now we've moved away from the bad stuff, this is the good stuff. So this is what best practice looks like. Now, first page, as soon as you log on to their website, right up the top there, in the middle of the page, English with a globe symbol. Now, if I don't speak any English, I can see that that's a globe symbol. That says English. I think that's where the languages are. Next slide, if I click on that button, bang, English and many, many other languages, all with the English, spelling and the native spelling. That's perfect. Now I can go, oh, perfect. I speak Italian. I can click straight through to Italiano. Bang. Pathing of the right resources. This hits on the navigation section. We can see that as soon as you've clicked on Italian there, not only does it take you, it doesn't take you through to some random page that says this is our website in Italian, blah, blah, blah. It takes you to their translated resources. It paths you to the right destination. And that's, once again, touching on that easy to get to 3-click principle. We can see we're right here. All I need to do is read that intro paragraph. Oh, okay, perfect. I'm in the right place. I scroll down a little bit to the next slide. And boom, links to translated resources with the right naming conventions. That's another key thing to navigation. If people, as Eva was saying, are in language and they're searching on the internet, they're not searching information about breast screening in Arabic. They're searching breast screening in their language, in Arabic. And having that naming convention there is going to ensure that your resources do pop up the top there when people are searching for your resources. Now, I might pass on now to Christy, who is yet again another amazing example of best practice. The countless things Diabetes Victoria and Diabetes Australia as an organisation do as a body are just incredible. They are big advocates for the COLD community, and working with them has been an absolute pleasure. I might pass on to you now, Christy, just to take over and tell us a little bit about the journey and information in your language kind of essence.
Great. Thank you. Thanks very much, Eva and Nick, for inviting me to present today. Before I begin, I'd also like to acknowledge the traditional custodians of the land on which I am, the Wurundjeri people of the Kulin Nation, as well as traditional custodians across all the lands and waterways across Australia. And I'd like to pay respects to elders past, present, and Aboriginal and Torres Strait Islander people who may be streaming in today. So when I was invited to participate in this, I was asked why is this a passion of mine? So a little bit of background, a bit of my story. So when you look at the broad definition of, and sorry, these photos are terrible. When you look at the broad definition of a person from a culturally and linguistically diverse background, that refers to people who are born overseas or who have at least one parent born overseas. Well, that actually includes me. My dad was born in Greece and migrated in the 70s to Australia, and my maternal grandparents migrated from Greece in the 1950s, and this is them, Kononefi, Konstantinos and Evstathia. And it was my grandparents in particular where I gained an understanding of the inequity and injustice in healthcare for culturally and linguistically diverse communities, observing their challenges in being able to navigate and understand the healthcare system. And even now, after living in this country for over 60 years, listening to their stories of racism and discrimination while trying to access healthcare in the early days of settlement for them as well makes me angry, and that anger really fueled my desire to work towards addressing this. So I have a really strong commitment to social justice, fairness and health equity, and I want to ensure, if we can just go back one, sorry Andrea, I want to ensure that migrants, people from refugee backgrounds and those who have low English proficiency, as well as our First Nations peoples, aren't an afterthought in public health planning and program delivery, and that we're not widening the gap in health outcomes between those who have high English proficiency and high levels of health literacy and those who don't. So as an organisation, Diabetes Victoria, it's our responsibility to break down the barriers, not create them. And so it's one of our 7 strategic priorities for 2018 to 2021 is access and equity. So we have committed that we will provide accessible information and services that respond to community needs, and we will celebrate diversity and work with our priority communities to ensure fairness and health equity. Culturally and linguistically diverse communities are one of our identified priority groups based on the fact that some communities have increased risk of gestational diabetes and type 2 diabetes and have poorer outcomes when they are diagnosed. And at Diabetes Victoria, we aim to work together with specific cultural groups and language groups to develop resources and programs that are culturally tailored and meet their needs. So, for example, we've got a very popular series of pictorial guides that support the self-management of people living with diabetes, and they're culturally tailored and in language. So where does the website sit in all of this? Well, the website, sorry, Andrew, if you can just go back one. The website's an absolute critical component of access and equity. Many people find our organisation for the first time through search engines and through our website, or don't find it. So it's absolutely important, absolutely critical that we make it as easy as possible. We are aware that there is a digital divide between those who can access internet and those who can't. And we've been told in our community consultations that online health information seeking can be challenging, that many culturally and linguistically diverse communities much prefer receiving health information face-to-face. And there's quite a lot of mistrust in information that's found online. So we need to address this in the way that we provide our websites and the information on the websites. We're also aware that in community accessing and navigating online health information can be challenging, and we acknowledge that it's often health professionals or family and friends that are finding information in language for people with low English proficiency. So we have to make sure that our websites cater for that as well. Website access, I'm a strong advocate of health literacy, and website access is one component of health literacy. So keeping in line with health literacy principles, we need to make sure that our websites are as easy as possible to find, to navigate and use for everyone, including people from culturally and linguistically diverse backgrounds. And this has already been mentioned, but the information provided on our websites needs to be provided in plain, easy to understand language, available in a variety of formats. And before we show our website, just wanted to also mention that we still have work to do. It's a never-ending process. It's always a learning process. There's a lot of things that I'd love to do with our website, so that's my disclaimer before we move on to share our one. So if we can move on to the next slide, please, Andrea. Our translated web pages have evolved a lot over the past 10 years. A few years ago, we did what Eva and Nick have done, which is look at lots and lots of different websites. We've reviewed them. We've had a look at best practice and had a look at what elements we thought we would like to incorporate into our website and what was also achievable for us as a non-for-profit organisation. We knew that we didn't want automated translation. And even though we would love to have more of our website translated in more languages and in more formats, we try and work with what we can, what we have. So just to walk through our current website, in terms of the translated information, you can see the real estate committed to promoting information in language. So at the moment, we actually have two banners at the top that are promoting information in language. So this first one here is Diabetes Victoria specific, and I'll show you where that clicks through in a few slides. The next one, just go to the next slide, please, is specifically around the National Diabetes Services Scheme website. They've recently updated their information in your language section of their website and added a lot more translated content. So we're also promoting that on our website too. And then at the bottom, when we then scroll down to the bottom of our website, we have a banner, and that's just on the next slide, which then shows a whole series of languages, and they're provided both in language and in English so that it's easier to know as a health professional which one you need to click on. So if you click on the English button or on that purple banner that I mentioned, you then go to the next slide and see this. So we have boxes in categories that hopefully are easy to understand, and a bit of a blurb underneath each one to explain what is in the next page if you click on it. And each in language page has exactly the same layout. So even if you are a health professional and you're looking for a video, you know that it's the first box, for example. So just as an example, the next slide shows what the Chinese one looks like. And then if we click on resources, so just the next slide, please. So this is an example of the Arabic page. And then the next one is an example of the Vietnamese page, also in resources. So as you can see, we've got lots of white space, minimal text, but it's the need to know information, some images, and it's culturally relevant information as well. So if we just go, thank you. So the principles that we've incorporated and used in our in the development of our translated web pages very much focus on health literacy principles around avoiding jargon and acronyms, and if we use them, we explain them. We use plain, easy to understand language, and just to mention as well, all of these things also really help the translation process as well. We have the easy to understand categories. We explain big pieces of information in bite-sized pieces, and also where possible, we try and use actionable language as well. And as already been mentioned, ideally, with any website and for any user, people want to find their information as quickly as possible. So the aim is to try and find information within 3 clicks. And if you go and test that on a website, it's always quite interesting to see how long it takes and how many different ways you have to try and find something. Yeah, it's always a good test. Imagery is really important as well. I'd preferably trying to avoid stock images as much as possible, and using real images of people who, community members who you work with is fantastic, and ensuring that there's a diverse diverse imagery across the website, not just on your translated pages, for example, and having the pages professionally translated. We'll go through to the next slide, please. We have learnt many things through this process. One of them is that some elements can be very complex. And from my perspective, I'm not a web developer, I'm not a web designer, or an expert at all in this field. So working together with others within our organisation, within our team, within media and communications, and then also external to the organisation. So web developers as well as language services also is a key to understanding what's achievable, and also that we can each play a part to improve the accessibility and the functionality of a website. So brainstorming some of the components of the website with a diverse group can be quite helpful to work out what you can and can't do. Acknowledging that sometimes this does take a bit of time, and that web developers often don't actually have the knowledge around how to incorporate translated content, and in particular languages such as Arabic, which reads right to left, especially we found was quite challenging to ensure that the formatting was correct. So in that instance, working together with either community members or language services organisations really helpful in ensuring that the content, once it's uploaded onto the website, is actually even readable and formatted correctly. You don't want to go to all this time and effort of developing the content, making sure it's in plain language, having it already translated, and getting it onto a website and the people can't even use it and read it. So yeah. My advice would be, if you're starting to work with a web developer on a new website, to ask them about their experience of adding translated content and get some details around how they approach it. Formatting and font size are also something that's been surprisingly challenging. I don't know if you noticed in the Arabic page, but the font is still very small, and it's something that we just haven't been able to resolve. Yeah, so there are still challenges. Content needs to be constantly kept up to date and current. So translating small sections rather than a big slab is really helpful, because then if you need to just update one little section or one sentence, you know where to find it, and you know that you're only going to update that bit, and that's a much more cost-effective way of going about it as well. User testing and involving community is also really important. Ideally, we would have worked together with consumers to develop the content and the design. We didn't have the capacity to do that when we developed our previous web pages, but moving forward, we definitely would do that. And I think it would have been just enhanced the web pages even further. And I just thought I'd mention as well that we currently have one Master of Public Health student who's undertaking a student placement with us, and we had another one last year. And both of those projects very much focused on the online space. So one of them looked at international students with diabetes, and another one is looking at online health information seeking behaviour for the Chinese community in Australia. And I think what was the key learnings to that is that this is such a fast moving space, that everything digital, and we're obviously all aware of this now with COVID-19, is that we're all learning as we go, and there just isn't enough evidence or evidence of best practice out there either. So that is quite challenging. I love a challenge, and so it's a great space for me to be in, but it can be pretty overwhelming when you're trying to find best practice guides and trying to ensure that you're reaching people online, and there just isn't that evidence in place. So yeah, I guess in summary, we really do need that evidence. We need more websites that show that these best practice components, but we can all work together. We can make small changes by working together with our communities, and that it doesn't have to be a huge investment, that we can make small changes to be able to reach community members and make it easier for people to find websites, navigate them, and use that information effectively. So, yeah, thank you.
Can I just thank you so much, Christy. Can I just say that I certainly feel very inspired by what Christy has said, because it really resonated with me, but it also shows you, I guess, how much work and how much commitment building a multilingual website is, or having multilingual components. But you know, I guess looking at it, we should look at it as an opportunity rather than an impediment, which is a message I wanted to leave you with. And I wanted to thank Christy and also Diabetes Victoria, as well as Breast Skin Victoria, for letting us show what you've done. And I know there's a little bit of vulnerability around that, because as Christy said, no one's got it perfect. And that's a good thing, because it's an area, it's a space that's ever evolving, and you know, many people are struggling. So I think reaching out to the community, you know, testing and also sharing information and resources will be the three key takeaways that I would like to leave you with. I know that Andrea's hanging out there behind the scenes with lots of questions, so go for it, Andrea. We have a few minutes, and of course you can always reach out to us. Perhaps the first question, if anyone's got a question for Christy, otherwise I'll do.
Yeah, so we have one question. Have you heard of Services Victoria? Basically, a lot of different websites are joined in one platform. Is there something as universal language design to make sure that people can easily navigate the many different websites and information, which is more and more centralized?
Okay, so that question I'll try to answer with one word: no. There is a fantastic website though, managed by Centre for Ethnicity and Health, CH, and that's Health Translations Directory, and it is fantastic because in there you can find many resources that are vetted and kind of approved, I guess. And if you've developed something that you're particularly proud of, you should put your resources there, because it reaches, it's a Victorian government initiative that's been passed on to CH to manage, but we are very much in support of that initiative. And as far as centralization, look, I think each of us still has the responsibility for managing your own, and it is fortunately, unfortunately, a journey that each organization needs to take themselves and be in charge of what you put on your website. And as far as principle, there's a lot of very diverse information out there. And each organisation, I guess, should do their own research. Would you agree, Christy? Is that fair to say? What does Diabetes Victoria do about that?
Yeah, I agree. We add our resources onto health translations. So I think that definitely is a place for centralised resources and for services, but also having it on your website is critical as well. Yeah.
Thank you.
So we have another question. Can Polaron help us reward resources to make them written in plain English?
We can, yes. And you need to speak to Nicholas about that. You know, Nicholas, have you got your phone there? Ring Nicholas.
Give me a call, guys. I'm happy to have a chat with anyone about any kind of service. Yeah, we do help with plain English as well. We can also help direct you to providers of plain English if you don't want to proceed with Polaron, but definitely we've got strategies to help you convert your website or even just content into a simpler format that's more easy to understand for cold communities.
That's all for now, I think. Thank you so much, guys. If you have any other questions from the audience, please feel free to send us your questions or inquiries.
Just in summary, I wanted to thank Christy for spending her afternoon with us, for Nicholas for contributing. On your screen, you can see all kinds of people that you can get in contact with, including myself. But look, I do feel inspired. I have to say that I had a bit of a whinge, so I hope that not everything that I've said came across too negative, but the reality is that we are all struggling and we're all in this together. I know it's a bit of a cliche, and I think we could do better than we are currently doing, but there are, on the other hand, a lot of very good practice examples, and you can, I'm sure that people from those organizations won't mind if you reach out and you know, ask questions, and we are always open to any feedback, any questions you might have. I will very quickly talk about a session that we're running in 2 weeks, and it's going to be about the elephant in the room, and that is the cost of translation. So come along and we will open our you know, closets and tell you everything there is to know about how much it costs to do a translation.
We have one more question, Eva.
Oh,
would you recommend putting translated content on the topic content page or all together in one spot regardless of the topic?
Yeah, that's a tough one, because it really does depend on what it is, and you know, is it just a translation? Is it a video? Is it you know, you need to think about, I guess, if this is helpful at all, about the journey of the user to the information you want to give them, and it'll depend on, you know, literacy level, age, you know, access to computers, whether they're using a phone. So that, you know, that conversation more than happy to have, but I think it is, you know, translation or providing information on your website isn't you know, it needs to be a tailor-made process. I can't give you all the answers. It's about workshopping the best practice for your organization.
Thank you.
Cool.
No more questions so far. No.
Beautiful. And I think we just 2 minutes over time, so we're right on time. Thank you again, Christy. Thank you, Nicholas. Thank you, Andrea. Thank you to many people that have attended. And yeah, keep in touch. Thanks, Christy. Thanks, Nick. Thanks, Andrea.